Hello, everybody. Thank you for coming. My name is Joe Huang Rakelto. I'm the Director of Government Relations and Public Policy for NMAC. And on behalf of our longtime Executive Director, Paul Kawada, our Board of Directors, and our staff, I'd like to welcome you to a special conversation with Congresswoman Barbara Lee, Congresswoman from the 13th Congressional District in California, on this conversation with the COVID effect on EHE funding. The Congresswoman needs no introduction, especially with this group, but I do want to highlight just a couple of her accomplishments. She was the actual co-founder and current co-chair of the HIV Caucus. She has been a steadfast defender of Ryan White funding, and in this current Congress, and especially an important matter to all of us, is the decriminalization of HIV. She has been the author of that bill. We're hoping that it will continue to gain momentum as the next Congress kind of moves forward. And just on a special side note, NMAC will be honoring the Congresswoman with our first ever Elijah E. Cummings Award for Minority Health Equality, named obviously after the great Congressman Cummings. It'll be held on World AIDS Day. Her and Speaker Nancy Pelosi will be our first honorees from NMAC. More on that will be forthcoming on our web. Congresswoman, we're pleased to have you here. I'm going to turn it over to you for any remarks that you would have on COVID funding and how it's going to affect ending the HIV epidemic, and of course, anything else you'd like to talk about. Thank you.
Okay, well, listen, thank you so much, Joe, for that very kind introduction. And let me just thank Paul and John, chair of the board, for inviting me to be with you today, and just say what an honor it is to learn that I will receive an award in Elijah Cummings' name. He was a friend, a mentor, and I remember when he was chairing the Black Caucus, we went into his district and looked at many of the wonderful programs as it relates to HIV and AIDS, and what the community was doing to really address the epidemic. And he was such a leader, and this is such an honor. I know that many are just really recovering from and catching our breath from the 2020 conference on HIV and AIDS. And at the same time that we're grappling with the challenges of COVID-19 and the impacts of racial disparities, we're still addressing the whole HIV and AIDS pandemic. So I hope that this conference, which is appropriately themed Family Reunion, has given you the inspiration and support and resources that you need to continue with your great work. NMAC's belief that the fight for racial justice and health equity are key pathways to ending HIV is to be applauded. Your partners have been so focused and really very, I think I would say, comprehensive in putting together such a valuable conference, making this conference free and accessible to the community, and that's what it means. And in this period of this terrible pandemic, there's one silver lining, and that is we generally can connect with more people because we're doing this virtually. So thank you again. And yes, I am the co-founder of the Bipartisan Congressional HIV/AIDS Caucus, and I also serve as vice chair of the State and Foreign Operations Subcommittee of the Appropriations Committee. So HIV and AIDS continues to be a priority for me. My California district is one of 57 jurisdictions impacted disproportionately by the HIV epidemic. And so we're working both locally and globally on this issue. From PEPFAR and the Global Fund to fight AIDS, TB, and malaria, which I worked with my colleagues on, to establishing the Ryan White and Care and Minority AIDS Initiative. Year after year, we've committed critical resources, not enough still, but critical resources to really end this disease. And I just have to say that this is a crucial moment, as you know, for Congress to work to mitigate COVID-19's impact on people living with HIV and AIDS. The COVID-19 pandemic has made it impossible to ignore how years of structural racism have created deep disparities in health outcomes for Black and Brown communities. African Americans are nearly 3 times more likely than white people to contract COVID-19. And let me tell you, 1 to 2 times more likely to die from the disease. Black, Latinx, Indigenous, and Asian Americans and Pacific Islanders are more likely to be essential workers and are forced to expose themselves to the virus. People of color are disproportionately affected by chronic health conditions and yet less likely to be insured and have access to healthcare providers. And so many of these comorbidities also impact people with HIV. In addition to the coronavirus pandemic, we know that 1.2 million people in the United States are living with HIV, and there are almost 40,000 new diagnoses each year. Also, communities of color and LGBTQ communities are disproportionately impacted by the HIV and AIDS epidemic. Now, the good news is that we have the tools to terminate and end the HIV epidemic, but we must allocate the resources equitably. And so, of course, a couple of bills that I'm working on, H.R. 8178, which is the anti-racism in public health, which would work to address racial disparities in health care, and that would commit resources to understanding and move forward to address the racially unjust health outcomes, which we see not only in the United States, but throughout the world. Also in the United States, we still have laws that criminalize people living with HIV, which is why I've reintroduced again the Repeal HIV Discrimination Act of 2020. This bill will help eliminate the harmful consequences of stigmatizing laws by pushing for reforms and increased transparency. Also, on the Appropriations Committee, we have to continue, and I will continue to push for funding levels, the highest funding levels, for ending the HIV epidemic initiative, which is focused again on communities most impacted by the epidemic. Most recently, the CDC awarded $109 million to state and local health departments for ending the HIV epidemic initiative. Funding recipients are using these funds to adapt plans to meet the HIV prevention needs of their communities and address challenges due to COVID-19. So we're fully engaged in the work to ensure that the revised HEROES Act or other emerging COVID-19 packages include robust funding for the Ryan White and other Department of Health and Human Services programs designed to support people with HIV and their healthcare providers. We also have been fighting to get language in, and we got it in to ensure testing. This is in the bill that we're still negotiating, that the testing reach medically underserved communities, particularly communities of color. So if we get this passed, the $2.2 trillion revised HEROES Act would allocate an additional $10 million to the Ryan White Care Program and $15 million for housing opportunities for people with HIV and AIDS. That's also known here in the United States as HOPWA. Also, we're aware, and I know you are very clearly aware, that HIV transmission is associated with homelessness and poverty, which again, much too high in the United States. We should not have anyone homeless in this country of enormous wealth. So the bill that we're talking about now would also provide indirect aid to the HIV and AIDS community, including $10 billion for the Supplemental Nutrition Assistance Program, $450 million for the Emergency Food Assistance Program, $1.7 billion for the Indian Health Services, $50 billion for emergency rental assistance, and several other assistance programs. There would also be a $13.7 billion boost to CDC efforts in terms of their overall activities and programs. So we have a lot of work to do. I want to thank you all for your commitment. We have to move ahead very assertively to address our goal of an AIDS-free generation by 2030. We know that resources, we have competing resources, but we also know that the resources are there to really fight for an AIDS-free generation and to end this pandemic if we just have the political will to do that. So thanks so much for your work and your continued efforts, and I continue to look forward to working with you.
Congresswoman, thank you for that. And after hearing you, there should be no doubt why we are honoring you. Could I ask you I know you have a hard shut off here. I just pulled a couple of questions, Congresswoman. Could I just run these
Sure.
questions? The first one is, with Black Lives Matter and the movement, and unfortunately the riots, President Trump now has threatened remarkably, under the umbrella of COVID and Black Lives Matter, to threaten to withhold, precious funding for cities. How does Congress intend to kind of, respond to that?
Well, first, we have an election November 3rd. That's our most effective way to respond to this. Secondly, as a member of the Appropriations Committee, we're going to continue to fund this. And, who knows, it may end up in court if he continues with this. But to penalize cities the way he is doing it because of his own personal views it's a moral disgrace, and he's not going to get away with it.
Okay, thank you for that, because I know there's a lot of anxiety. I'm just going to ask you one more question, Congresswoman. We'll get you out of here by 1:30 our time. If Democrats should take the Senate and retain the House, do you expect, after these current CRs expire in the new year, do you expect HIV funding to be increased?
I'm certainly going to fight to make it a priority. And I was on the drafting committee for the Democratic Party platform, which was negotiated with representatives from Joe Biden and Kamala Harris's campaign. And certainly we have major policy initiatives to talk in that platform that suggest that we will be supported by the White House. In Congress, we're going to fight to increase the funding. And with the Senate, I'm sure that we'll be able to move forward with the White House to increase the funding, because we've still not achieved the level of funding that we deserve in these accounts. And so I say I'm cautiously optimistic, but that's going to take a lot of work, and all of you who can help us with that is going to be very important, because we're going to need major influencers and people from our partners on the outside to weigh in with members of Congress to make sure this happens. But certainly as a member of the Appropriations Committee, that we're going to fight in the House to make sure we do increase the level of funding.
That's good to know. Congresswoman, I know you have a 1:30. We do very much appreciate you taking the time to update us on your good work, and we're very much looking forward to seeing you on December 1st, World AIDS Day, to the Elijah E. Cummings Award for Minority Health Equality. Thank you, Congresswoman, and your entire staff. They've been talented and tremendous during this process.
Thank you. It's been an honor, and thank you all for your support, your friendship, and more importantly, what you're doing each and every day to address the HIV/AIDS pandemic as well as the COVID-19 pandemic. These are very challenging times, but we're going to get out of this together if we do the right thing by each other. So thank you.
Thank you. That concludes this webinar. Chip, I'll turn it over to you.
All right, everyone, thank you so much for joining us. You will receive an email link to recording this webinar tomorrow, and the recording will be available on the NMAC website starting tomorrow as well. So please look for that, and we look forward to seeing you on our next webinar. Thank you so much for joining us.
Thank you.